In order to make the full mouth restorations temporary is very imperative for the patient. If I want to do the full mouth restorations, I will do like this. I'm going to give you some more information and also a tip for you. In this case, patient has the bad teeth and the doctor will going to take it out the old anterior teeth, and I got the model from the dentist. I can pull out the teeth just like dentist, and I can make the convex areas underneath. And tip is here, we have to know the tooth position, what look like along with the bite. In this case, it's pretty good teeth size of positioning, so which is great. So my video, as you can see, my video I can grinding, just I pulled out the teeth and make the concave all the way bottom. Looks like I make the CJ, the teeth looks like gum here. Number one, we have to prepare it teeth before we go to full mouth restoration. Number two tips, I have to make the custom abutment instead of the tie base. Most of the time, dentists are trying to save the money and they put it into tie base, which is bad because this is big. And you using the only tie base in between both two here and two there, and the patient wear 3 to 6 months, is not going to work. What they cause, and the tie base is cementation failure. So it will not stick together. So after 6 months later, doctor will get phone call from the patient because they're falling apart. And number two, probably fracture because one side leaking, one side down, once they biting together and chewing it and then crack it too. So I made all the time the custom abutment. We put it in the scan and design, and then we set the tissue position. If tissue position is bad, I have to more cut it, the better. Because the doctor can put the inside patient's mouth, they can cut that area too. Here's my goal. I want to get the perfect as much as possible. Number one, longevity. Number two, cleansability. Number three, aesthetics. That's why we have to make this. So after we make the custom water, which is we mill here, and this is Bio Horizon, we made hex because I cannot make the non-hex. The doctor have to put in the patient's mouth like that. So after this, so we design it after mounting, and doctor gave us the good stick bite, the vertical and horizontal, and then we design and then we mill called the PMMA. See my video as a grinding, finally as a feeding, grinding. If I need more add underneath, then I have to add more convex, just like football types. So patient pulled out the teeth, they secure their position, and then 6 months later, that tissue areas will be beautiful. And so we'll get really cleansability. So probably we don't need any pink porcelain. I'm trying to make the lifelike restoration from the gum and adapt with my temporizations. Once they satisfy for this, if they don't, maybe they cut it here, cut it there, not a problem. This is a guide. Not only this, doctor will go and take the new impressions. There will be tissue area is just beautiful. And the other tip is this one is a long span, as you can see. So we recommend this wire in the back side, and then we cut it and put it all the way wire. Here's the most important things. See my videos, occlusion forces. So occlusion forces from the is not only the bite, chewing, and then we have to see the all movement that will be better. So reason I can explain to you this kind of full mouth restoration, like I said, is very imperative. Provisionally, we're not going to be perfect, but we prepare it about hygiene, longevity, aesthetic, the contour, those kinds of things. That's why I would like to share with you guys. Probably dentists know how I do it, but some dentists don't know, some laboratory guys don't know. We are laboratory. We are working with the dentist. So I would like to tell them, I'm trying to guide them because I do have a lot of followers. I have to show them the right direction. It's not hard, but it's a little different procedure. They can follow it and we can prepare the patient as best as possible, the full mouth restorations. The lowers is previous patient has it. Okay, looks like lower is a zirconia here, and then upper I made a little bit bigger than normal, and this is the final will be. Doctor will go into cement and put it into this one first because I cannot cut it at the hex area, and then I have to put it in the mouth, and then they try this, and then I have to hold out the teeth, and then they put together, and then they temporarily cement or cement it, so they can check the bite, and they can let us know the final tooth preparation, the future case 2. This to me, this is all the zirconia case 2. All right. So I like the buccal contour. I like the symmetry. I like the from the margin direction. This is a final. Thanks for watching my channels. I'm glad I talk to all the time, but this is our daily cases. I work with all the time, and then I can share with you any question. You can feel free to write it down. See you next time. Thanks for watching.